Cancer pain is a very difficult topic of conversation because there's a lot of different types of cancer pain. Pain from cancer, pain from the treatment, the emotional pain afterwards. What are some of the pains that we experience or that you have found your patients experience?
I've asked my patients about their experience of cancer pain, and almost without exception, all of them have been able to summarize it in 2 words. It's complicated. And that is so beautiful, and such a beautiful way of describing how they are feeling, because it's not just one pain that they experience. Very often it's more than one pain in more than one different place, caused by more than one thing. So cancer pain is indeed complicated. Cancer pain can be caused by the actual disease. And very often, pain is the thing that made you go to a doctor in the first place, to go and see, what is this? What has changed? Why am I experiencing this stabbing, burning, throbbing pain in my tummy, in my breast, in my arm? Cancer pain can also be caused by the treatments for cancer. So if you can think of surgery, when a surgeon would cut out a tumor, that is painful. Or perhaps it's the numerous blood tests that you have, a pinprick to take a blood sample, or a prick to access an A port, a chemotherapy port. Sometimes radiation therapy can be experienced as being painful, not necessarily while you're having radiation therapy, but the side effects of radiation therapy long term can cause pain. Certain of the chemotherapies most definitely can cause pain. Some are burning and they really can be very uncomfortable when they're being administered or afterwards. And again, a consequence of the side effects can be interpreted as being painful.
So are there specific categories of pain? Are there designations for different types of pain that we're experiencing? Or is it just like pain is pain, report your pain?
Certainly, pain is a very individualized experience. Some of the categories of pain, if you'd like to call it that, or what causes that pain, could be a pain that is experienced by organ or tissue damage. So a cancer is growing in a particular organ or tissue and it's causing pressure against nerve endings, it's causing pain. And it would be described in very specific terms as to that experience. Throbbing, a deep pain, a burning pain could be some of the words, the adjectives that are used to describe it. There's a different type of pain, which would be pain as a result of nerve damage. Perhaps the surgeon has cut through a nerve, or the nerve has been damaged by certain treatments. And that may be described by the person experiencing it as being throbbing, electricity, hot coals, stabbing pain.
Some of the other cancer side effects may feed into that, like the peripheral neuropathy as an example.
Exactly, peripheral neuropathy, which our video describes quite accurately, speaks to that exact problem of that particular type of experience of pain.
Okay.
There's a third category of pain that comes as quite a surprise sometimes, and it's called breakthrough pain.
Okay.
Despite the patient being on excellent pain control, everything managed under control, out of nowhere, you get this whoosh, transient pain, this breakthrough pain that comes through totally unexpectedly, most often, although sometimes there are triggers that can actually cause this breakthrough pain or make it more prevalent. So, for example, an exposure to a bright light source. That might be the trigger that in your instance causes a breakthrough pain. Very difficult to control breakthrough pain, and it's very difficult to treat breakthrough pain because very often it's unexpected.
So to briefly summarize the 3 categories, we could potentially see a internal pain, so a deeper pain, things like your organs, your tissues, specifically around treating areas, maybe muscles, etc. Your second category may be your peripheral pain or external pain, things experienced in your limbs, your skin, your senses, and then your breakthrough pain, as you spoke about. Is that a good way of summarizing the 3?
No, because there's so much overlap between them. So I think it might be easier to talk about the descriptors that are associated with each of the different types of pain. So a descriptor of deep, throbbing, sometimes stabbing pain might be a pain that is more associated with nerve fibers called nociceptor nerve fibers, which can be in the skin, but they can also be deeper in some of the organs, some of the muscles, some of the tissues. Whereas the nerve damage, which is peripheral nerves more often the descriptors associated with that type of injury or pain could be tingling, pins and needles, stabbing, electricity, hot coals. Those are some of the words that may be used.
So there's a lot of overlap between the two, hence the complicated descriptor that you used earlier, but you keep using the word descriptor and using all of these descriptions to describe your pain. Why is that important? Is that an important thing to communicate?
It's very, very important because this is an individualized experience. I might not experience my pain the same as what you do. And the way I describe it will give the healthcare professional an idea as to the possible origin of that pain. But it also, because it is such an individualized experience, pain is what I say it is. So in that moment in time, if this is how I'm experiencing it, you need to take note of that. I can be having a pain experience today and a pain experience tomorrow. I'm the same person, but it might be a different experience because of where I'm at emotionally. Perhaps today I'm really in a rough space. I'm just not coping well today. And so the pain, the physical pain that I'm experiencing is enhanced. I'm battling to deal with it. Whereas tomorrow I'm in a good space and I'm feeling very positive, I'm feeling very chirpy. I'm dealing with that pain, I'm coping with that pain far more efficiently. And so my experience of it is different. So when I talk about my descriptors, it's massively important to take note of how I'm feeling at that moment in time.
Thanks for tuning in and watching our video. If you have any questions, comments, or even suggestions on what you'd like to see in future content, please leave them in the comment section below, and we'll get back to you as soon as we can. We're here to support you in your journey to learn more about cancer and how to manage it. Join our community and empower yourself with knowledge and resources to make informed decisions about your health.